Hi, my name is Hope Harjo, and I'm covering Asperger's syndrome treatment. And I'm just going to start with the treatment basis. And treatment is based on the hallmark symptoms of Asperger's syndrome: poor social skills, emotional deficits, special interests in a topic of choice, and overall impairments in communication. Treatments will have the same standards but vary from patients that have high functioning to severe. A brief list of what treatment will address is difficulty of poor social functioning, eye contact, executive functioning of impulse and selective attention, anxiousness, communication and nonverbal communication, impaired social cognition, and lack of understanding social cues. Treatment methods can range from cognitive behavior therapy to social skills training and speech language therapy, applied behavioral analysis, sensory integration, occupational therapy, parent education and training, and lastly is medication. It is highly effective to begin treatment early on following intervention. Treatment methods are based off of the symptoms of Asperger's syndrome. Training and therapy rely on communication and behavior coping skills. There are a wide range of therapy treatment, but each have the same basis and goal. This is to build better behaviors associated with social skills and communication skills. Effective treatment programs will face symptoms head on. They will build on the interests of the patient, promote self-esteem, reinforce social abilities, encourage special skills, be sensitive toward patients' emotions, have a set of goals to progress toward or meet. They will provide a healthy and professional support system. It is also helpful when patients are compliant. Individualization. Therapy should individualize criteria for each Asperger's syndrome patient because no patient is exactly the same. Each patient may have difference of severity of symptoms. Tailor-made therapy will heighten progress. Assessment. Counselors should have correct assessments for patients because treatment will be based off of it and the diagnosis. This is why there should be proper evaluation of patient because the patient will be relying on it. There should include careful research of history of patient, developmental history that might explain current behaviors. This history can be from infancy to childhood and into adulthood. The last treatment is medications, and in medication, patients treated to a program or therapy that target Asperger's syndrome would have had a referral to have final treatments of medications. Medications will vary depending on symptoms of patients. Examples can be patients having aggression or depression. Patients should be treated in some sort of therapy or training setting when pairing medication treatment. To conclude, Asperger's syndrome programs, training, and therapy treatment generally have the same goal in mind and similar criteria in meeting that goal as discussed. Patients will learn to cope with his or her own behavior and making adjustments. Treatment will recognize deficits and present revisions. With a correct approach and assessment of each patient, there can be hope and healthy progression for those with Asperger's syndrome. Thank you.